Welcome to Let's Talk Micro. Hello, everyone. Welcome to another episode of Let's Talk Micro. I hope you had a great week. As always, Let's Talk Micro is available on Apple Podcasts, Spotify, Google Podcasts, Overcast, Stitcher, TuneIn Radio, Amazon Music. Wherever you listen to your podcast, you can find Let's Talk Micro. I am also on Instagram as Let's Talk Micro, no apostrophe, and on Twitter as Let's Talk Micro 1. So go ahead and follow. I always like to post pictures of organisms and give updates as to when the next episode is coming out. So leave feedback, any suggestions for any topics. Any feedback is welcome and appreciated. And by the way, this week is lab week. So I'm a medical laboratory scientist, and I want to thank all my fellow medical laboratory scientists and those laboratory professionals. Anything that you do, anything from LIS, from management, supervisory, education, advocating for better wages, more recognition, anything that you do, I really thank you for all your work, both in and outside the lab. Thank you so much. And if you haven't listened to last week's episode, go ahead and do so. It was my turn on the hot seat. I got to work with this podcast called The Micro Moment with the Microbiology. They're a very popular podcast, and I am grateful for the opportunity. So in this episode, I was the one being interviewed, and I talk about my experiences as a medical laboratory scientist. At one point in time, I was a supervisor, so I talk about the day-to-day responsibilities of that. I go over what it's like to teach, how's the format, especially now in times of pandemic. Is it online? Is it in person? So I talk about all my experiences in all the areas that I have worked on. As a laboratorian, as a teacher. I had a great time with the micro moment, and I thank them for the opportunity. So it was a great interview. So go ahead and check it out if you haven't yet. It is episode 43. The Micro Moment Talks Micro with me. And today's episode is an interview episode. I had the pleasure of talking to Dr. Daniel Rhoades. He is the section head of microbiology at the Cleveland Clinic in Cleveland, Ohio. And he came over to the podcast to discuss an article titled Deep Convolutional Neural Networks Implementation for the Analysis of Urine Cultures. So this article talks about a software that was tested called BacterioSight and its future applications in the lab. I mean, those of you that work in the lab with urine cultures, sometimes how subjective it can get, how sometimes there's this gray area, especially with those that are mixed. And you are also aware of instruments such as the BD Keystra with automation. So we talked about this BacterioSight and look of how this software can be potentially applied to an automated instrument such along the lines of the Keystra. And this software can actually do the reading for you. For example, if the culture is negative, it can go ahead and it recognizes that and it can result it. Basically the same concept as those of you that work in hematology, with the autofile, right? You run the sample on the Sysmex, let's say, or any other instrument. And if it's, has some parameters that have been validated, and if the sample meets those parameters, the technology doesn't touch that diff. It will autofile along with the results. And if anything is abnormal, then that's when there is a flag. You pull the sample, you make a slide. So think along those lines with this BacterioSight. It can potentially reduce the amount of time that you spend working on cultures by, it's reading the negatives. So you can focus on the positives. It can also flag those gray areas. Is it iffy? Is it mixed? Is it pure? Bringing it to your attention so you can maybe consult with another technologist, maybe with your director, to see what kind of call can be made with this. So it looks, it looks like it can be very promising that it can actually contribute to the efficiency of the lab. As you know, one of the challenges that we have in the lab a lot of times is the time factor. When we have a lot of cultures, we spend so much time with them. So if software like this, it can reduce the time that we might spend on some cultures, let's say the negatives, and then we can focus on the positive cultures, that will make our workflow more efficient. And some results from the BacterioSight were compared to images from the BD Keystra that were looked by technologists, and the results actually look pretty good. We are heading in an era of automation, and as our volume increases, anything that we can do to improve efficiency, it's always a plus. Like incubators where there's limited access to the text, that way the organisms can incubate longer. And software like this, where perhaps the time that we spend on negative cultures can be reduced, and then we can focus more on positive cultures. So let's go ahead and listen to the interview. So today's an interview episode, and we are here to discuss a study that was done on urine cultures. And the article title is Deep Convolutional Neural Networks Implementation for the Analysis of Urine Culture. This was published on the Journal of Clinical Chemistry of the American Association for Clinical Chemistry this year. So today with me, I have Dr. Daniel Rhoades. Dr. Rhoades, welcome to Let's Talk Micro.
Thanks so much for having me, Louis.
You're welcome. So let's start by telling the listeners what's your occupation?
Yeah, I'm a medical director for a microbiology laboratory. Currently, I'm at the Cleveland Clinic.
Okay, so the Cleveland Clinic in Ohio. Okay, so the question that I'm going to start asking is, so what was the purpose of this study?
Yeah, well, the previous position I held, I was at a different hospital system, University Hospitals, which is also in Cleveland, and we had been using BD Keystra's lab automation for a number of years. And so we had gotten used to performing urine cultures and looking at the Petri dishes digitally, on the screen instead of holding them in our hand and interpreting them in that manner. And we had tens of thousands of images of these urine cultures, and we also had the paired interpretation from the medical laboratory scientist as to whether those urine cultures were interpreted as essentially being positive or negative or indeterminate. And we thought this might be a good use case to employ artificial intelligence to see if the computer can figure out when we interpret it as positive or negative.
All right, very well. So can you do for the listeners what's a brief summary of the study, please?
Yeah. So it was a collaborative work. So there were we worked with both WashU's laboratory in St. Louis and University Hospitals in Cleveland. There's a data scientist who developed the software, and microbiologists, molecular pathologists. So we all worked together to try to see if we could build a computer algorithm to interpret images of urine cultures and interpret them as either negative or essentially negative, right? Sometimes we call that, minimal urethral flora, or sometimes the plates are just clean, right, with no growth. Those are easy. And then the others are, positive, and sometimes those are easy, right? If you have 100,000 CFUs per ml of E. coli, that's an easy call. But what's challenging for everybody, including, it turns out, the software, is figuring out where to draw the line between positive or negative, or when to issue an indeterminate result saying it looks like it was contaminated at the time of collection. We can't tell if the bacteria in here are from a urinary tract infection or just from contamination during collection. So we used tens of thousands of images and interpretations from laboratory scientists, and developed the computer model, and then tested that model with a challenge set. And it turns out that the computer actually does a really good job with most of these. And actually, since it's trained, kind of with interpretations from the whole laboratory, the model, you could argue, actually does better than any one individual at interpreting a single image of a urine culture plate.
Okay, so and then these images that you said that they were looked by technology, so they were from like a system like the BD Keystra.
Yeah, so BD Keystra was the automation system in place that captured the images just part of standard of care. And then post standard of care, we maintained the images in the, save those images, and we knew how they were interpreted because that information was in the laboratory information system. And then retrospectively, we were able to do the study on the interpretations and the images.
So as I was reading the article, I saw this term fuzziness. Can you talk more about that?
Dr. Alawani, who's the data scientist who developed the algorithm, taught me that term. So that's a data science term. Apparently, I'm trying to come up to speed with all my data science terms. So fuzzy data are things that are difficult to interpret, right? It's difficult to say what the truth is. Sometimes when I explain this, I like to use a color gradient, right? Like blue to green. So if you imagine a color gradient from blue to green, you can point to the blue side and everybody would say, yep, I agree, that's blue. And you can point to the green side and everybody would say, yeah, I agree, that's green. Or sorry, blue on the one side, green on the other. Everybody's going to agree. And then somewhere in the middle, it's going to transition from blue to green if those are your only two options. And everybody's going to pick a slightly different point where they would say it's blue or now it's green. So that transition is fuzzy, right? There's not an absolute truth that everybody agrees upon. And it is really subjective. So that's the challenge when we're training an algorithm to call a urine culture positive or negative. Sometimes people use a cutoff of like 100 CFUs per ml, right? Well, what if it's 99, or what if it's 99.9 CFUs per ml? When do you really draw the line? It's not as clear cut as like doing a blood cell differential, right? It's either, that's usually pretty clear. It's a lymphocyte or it's a neutrophil. There's not, something in between a lymphocyte and a neutrophil. But with a urine culture, there's definitely a gray zone in the middle between positive and negative, and everybody makes that determination a little bit differently. So the truth is essentially fuzzy. It's not clear cut, and that's challenging for all of us.
Yes, it's definitely challenging. And as you were talking about this, I definitely started thinking about it. And yes, I have worked in several areas, and of course, micro being my favorite. I can't get away from it. I love it. But there's always that gray area. It is, yeah, there's definitely you have to use a lot of judgment. And definitely with the cultures, even by working them the regular manual method, when you're looking at the plates, making that judgment, like, do I work it up? Do I don't work it up? Does it look mixed? Doesn't? So it's always challenging, especially when you're like a brand new, recently graduated technologist. So you start seeing all these extra plates being worked up and all these organisms while everyone starts getting more comfortable in making that judgment. So yes, it's definitely a lot of gray.
Yeah, I don't think I think everybody who does the testing, right, who interprets what's growing on a petri dish, can appreciate that. But I don't think that a lot of people outside of the microbiology lab recognize the fuzziness.
Yes, and before I ask the next question, years ago I used to work with the Previ isola. I don't know if you're familiar with that one, but yeah, there was like this zone that if there was some growth there, you should interpret it as no growth, and I used to see so many plates of technologies working them up because it's like, no, but it's growing. How can you say it's not growth? So that adds definitely to that gray area. It's like, I'm seeing it. Why am I gonna call it no growth? So that was definitely a challenge when we had that instrument. Now we don't have it anymore, so we don't see that. But yes, definitely a lot of gray.
Yeah, the Keystra uses inocula. Not, I'm familiar with the Previ. I've never used it, but Keystra's front end is the inocula, and what's challenging for a lot of people is the minimum volume that it will plate on a petri dish is 10 microliters, and most people who do urine cultures are most commonly used to using a 1 microliter loop. So when they encounter that 10 microliter inoculation, they kind of have to recalibrate how they interpret urine cultures, because you can't count 1,000 colonies on a plate and say it's 100 CFUs per ml. The approach has to change a little bit.
So, what are some future applications of BacterioSight in the clinical lab?
Yeah, when I talk about using these AI applications, such as the one that was built for urine cultures, I like to think about the opportunities for both efficiency and quality, and you can use it for both or either. So a couple examples of how you might employ this software tool to improve quality or efficiency would be, for quality, let's say that we have an image of a petri dish, of a urine culture, and the algorithm knows that it falls into the gray area, right? It's seen hundreds or thousands of these borderline cases, and it knows that it's challenging to interpret. So it might be best, instead of just whoever's on the bench that day making the call, maybe it's best to get a consensus as to what to do with that, or maybe it's best to bring that up to the medical director so they can review the chart and see what's happening clinically with the patient. You could potentially improve the quality of the interpretation of the growth if you know that it's this culture is hard to interpret, and so don't just go with what one person says. That was one way to maybe use this to improve quality. Efficiency is another application that could be used. So the algorithm does pretty good at saying no growth, right? You can imagine it's not hard to look at a petri dish and say there's no colonies on there. That should work pretty well. So if that is the case, then why take my time? Why take our time reviewing those manually? If the software can look and say there's no colonies on there, we should be able to sign that out without a manual review, right? Again, going back to hematology, everybody's now accustomed to the auto diff, right? It's not many times, if nothing's unusual, the white blood cell differential goes out without anybody even looking at the white cells. We validated the instrument and trust that it can tell the neutrophil from the lymphocyte, and the results go out. I'm pretty confident that that's going to be the future of microbiology eventually. I'm not sure when, but at some point, I think we'll be able to focus more of our effort on the challenging cases and let the computer take care of the really straightforward ones.
Okay. So then this, like this type of software will be like attached to something like a system, kind of like the Keystra or something along those lines?
Yeah, so the two kind of big bacteriology automation systems in the US right now are WASP Lab from Copan and Keystra that's made by BD. And then there's some other systems like Clever Culture Systems has a smaller unit that's not quite as integrated into the laboratory workflow. And then I2A is another platform, but that's not really in the US. But there's more and more movement towards automation in bacteriology, and as it becomes more and more routine to capture culture plates, images, there's going to be more and more opportunity to develop software tools and implement them in creative ways to provide better quality or efficiency in the laboratory.
So just a quick question about, so you're familiar with the BD Keystra. So, I haven't worked with it. I mean, my lab only has the portion that, the inoculate portion. But from what I read, so it really reduces since the plates are just incubating and no one opens and there's not that constant opening, it really reduces the time that it takes, right, for them to be flagged as positive.
Yeah, there's some studies that have been done to show that these automated systems seem to be able to recover growth of the colonies more quickly. And the hypothesis is that, like you said, it's the temperature is maintained more steadily, so the growth can happen uninterrupted by temperature changes in humidity. So and there's also been people have noticed that they recover organisms that maybe they weren't recovering before, like Gardnerella, is maybe recovered more readily, whereas in previously, before a lab has implemented an automated system, they weren't recovering that as well.
Yeah, that's definitely one of the challenges of laboratories that don't have that they don't have an automated system like that. It's just always, especially the larger the facility gets, there's all that frequent activity all day opening the incubators, and then you on top of that, different techs have different methods. So sometimes you have the tech that takes everything out at 6 in the morning, and then those plates are sitting there for 3 to 4 hours. So you have all these variables. So, and yes, I also seen it with blood cultures, like for example, like the Bacti alert, where you were opening the drawers and scanning, and then you had sometimes all this false negative popping out. And then with the virtual system that, the bottles are there, the negatives are expelled, it's so sensitive that it gets to the point that sometimes, it flags you don't see anything, and you have to do a cytospin, and then you see the organism. So that, human factor of us opening and closing definitely affects the growth, I would think.
Yeah, no, it's kind of an unintended consequence, I think. The automation systems are, I think the main, marketing point for those is that they improve the efficiency, right? People can do twice as much work because, they're not shuffling plates. But then there's these other unintended, I would say, secondary improvements that we've noticed along the way as well. And it's nice when it works even better than you're expecting.
It definitely is. So, I mean, you kind of talk about this a little bit, but I will ask the question. I mean, there's definitely, like you said, in other areas of the lab that I've seen, we definitely, like in hematology, your negatives auto verify. The same happens with your analysis. I've seen it on coag. So there's many areas where that, the autofile function is applied, and it definitely reduces the amount of samples that you have to go through and check. So the study mentions that perhaps, BacterioSight can be used to auto verify one day. So I know you mentioned something, but can you talk more about how it can be used for microbiology?
Yeah, I think probably the first systems that we'll see that will auto verify cultures will be identifying no growth. I'm not an expert with the FDA, but it's challenging to bring new tools to the FDA. But what the FDA does recognize currently are essentially colony counters. And so if you demonstrate that your instrument can work like a colony counter and it can accurately count 0 colonies, then if you have a no growth plate, the instrument should be able to identify that, and I would say, report that without review potentially. I think that's the lowest hanging fruit for implementation of these kind of algorithms. And then, the next steps would be, working up cultures that are obviously positive, right? Like we talked about that, greater than 100,000 CFUs per ml of E. coli, which is, the most common pathogen you encounter in a urinary tract infection. So if it can, make that suspected call and then, circle the colony that needs to be worked up for susceptibility and definitive identification, I think from a regulatory standpoint, that'll take a little more work, but I think it's completely feasible technically.
Okay, yeah, definitely that will be very helpful, especially facilities where you have such a high volume. So maybe by not having to touch all those negative plates and work with those, then you can spend your time more appropriately working the ones that are positive and susceptibilities and other areas of micro.
Yeah, and you mentioned the Virtuo that bioMérieux makes for blood cultures. Blood culture automation has really come a long way. If you talk to somebody who's close to retirement age and has spent 40 years in the micro lab, they'll tell you how they used to go in the walk-in incubator every day and look for growth in all the blood culture tubes that they bled the patients into manually, right? I mean, we do use automation in microbiology. We sometimes forget about it or don't think about it too much because it's become so routine. But for susceptibility testing, oftentimes nobody's looking at that well, to see if there's growth or not. We trust that the instruments can find turbidity, and we validated that, and that's what we use routinely. So, this is kind of a next step in automation, but It's not like, some people worry that our jobs are going to go away or something like that. But I would argue that that risk is very low. We've already implemented a lot of automation in microbiology, and it's still hard to find enough good people to do all the work.
Yes, indeed, and we actually have gotten so used to the automation that sometimes when the lab, going back to blood cultures, if we get, let's say, like the bottle that doesn't go with the instrument, and then we do have to do the manual process, everyone is like, oh, here we go, like just checking it, doing the twice a day, so everyone looks at them. And sometimes, especially if you get them from some facility and you get many, you definitely hear the complaints in the lab. So yes, we definitely have gone a long way in automation.
Yeah. I mean, technology is great when it works, and we learn to live with it and lean on it. And like you said, we don't even recognize it sometimes until it gets taken away from us, and then we realize how much we rely on it and appreciate it.
Yes, indeed. Um, so is there anything else you would like to tell the audience about this study?
So I think this study is one in kind of a recent series of studies that in microbiology demonstrate the potential implementation of artificial intelligence to interpret images. There's been a couple other recent publications that that look at other areas of microbiology. So I think of one that was published not too long ago from a group in China doing Nugent score gram stains for bacterial vaginosis, and then a group TechSight and ARUP out of Salt Lake published one not too long ago about using a similar, artificial intelligent neural network for ovin parasite trichrome testing. So this is, I feel like there's lots of different angles to explore and potentially implement image analysis tools like this. And I was excited that we got to work with Petri plates and cultures, but I expect microscopic images we will also in the not too distant future be rolling out applications for artificial intelligence and microbiology for microscopic images if you're not in a lab that's already using that.
Dr. Rhoades, thank you for taking the time to coming to Let's Talk Micro and sharing this information with us.
It's been all my pleasure. Thanks so much for having me, Louis.
You're welcome. And for the listeners out there, on the episode, you'll see the link for the study if you want to go ahead and check it out and read it. All right. Thank you, Dr. Rhoades.
Thanks so much.
And that, my dear audience, it's the end of this episode. I hope you enjoyed listening to Dr. Rhoades' interview. I enjoyed sharing it with you. As always, stay motivated. Keep bringing that passion to what you do. Happy Lab Week again. Thank you, all you laboratorians, for all your work. I experienced it myself, and I know it hasn't been easy with the pandemic. Supply shortages, short staff, and yet we all stepped up and did our jobs and took care of our patients. Thank you so much for everything you do. As always, stay motivated, stay safe, and of course, continue talking micro. Until the next time, bye.